Welcome to this British Psychological Society audio interview. I'm Wendy Barnaby, and with me is Dr Jonathan Roiser from the University College London Institute of Cognitive Neuroscience, and John is a previous winner of the Society's Spearman Medal for his outstanding work. So welcome, John, and congratulations.
Thank you. Thank you for having me.
I wanted to ask you about the brain and depression. You study the brain in order to understand depression. Why would we want to study the brain, though? I mean, it's not obvious, perhaps, what role the brain would play in the way the mind works.
Well, I think the best way of starting this off is to think about where the mind comes from, so where our mental states come from. Modern neuroscience has shown quite definitively that all of the mental states that we experience, and that includes all of the feelings as well as all of the thoughts and all of the perceptions, are strongly related to activity that is going on in the brain. And pretty much all neuroscientists believe that the mind is derived from brain activity directly. So it's actually the cells that are firing the electrical patterns in your brain cells that are causing this subjective experience, this mind, your own personal experience, to actually exist in the first place.
So the mind is what the brain does.
Yes, exactly, this famous quote from Marvin Minsky. And I think that's a nice way of putting it. So I suppose my position is that it almost makes no sense to try and understand depression unless we also try and study the brain as well. And that's not to say that the brain and the mind are exactly the same thing. The better way of thinking about it is that they're two sides of the same coin. So, of course, we can look at brain activity. That might not tell you exactly what someone is thinking, but we can certainly see correlations there. And when we manipulate brain activity, we can certainly change the way in which people perceive and the way in which they think and feel. The modern thinking from the neuroscience side of things about what depression involves and how to get people better is really around these ideas of the brain circuits and their activity. And there are different ways into getting those brain circuits changed.
Well, I was going to ask you, I mean, we do have other treatments for depression, so what can neuroscience add? I
think what neuroscience adds is an understanding not necessarily of what new treatments are going to be. It might do that. But actually, the really exciting work that's happening at the moment is actually understanding how the treatments that we have right now work. So you probably know that many people who suffer from depression will go to their doctor and they'll get something like an antidepressant drug, which might change the levels of a brain chemical like serotonin. But these brain chemicals aren't themselves causing people to feel happy directly. What they're doing is they're changing activity in these brain circuits that I was speaking about before. And then over the long term, it seems that that change in activity corresponds to an improvement in people's mood. But similarly, we have talking therapies as well. So in this country, cognitive behavioural therapy is a very popular form of therapy, and it seems to work extremely well in many people. But again, these talking therapies are having a direct effect on the brain. Whenever you're talking to someone, your brain activity is changing. When you're listening to someone, your brain activity is changing. And we can indeed track the changes that occur in people's brain circuits in terms of their brain activity or the connections between different parts as they get better through a course of cognitive therapy. So all of the treatments that we have are actually working directly on the brain.
So you can actually see, can you, the way the brain changes its workings according to what sort of therapy people are having or how much better they're getting?
Yes, that's exactly right. So there have been several studies using modern brain imaging techniques or neuroimaging techniques. Magnetic resonance imaging, or MRI, is one of these. These allow us to get an idea of where the activity is greater or less in people's brains at different points in time. So we can track people, as you say, as they go through a course of treatment and see which parts of the brains have changed in their activity. And then, in particular, in the last 10 years or so, people have got very interested in the idea that brains consist of circuits, not individual regions. So another important advance is the idea that we can look at the connection strength between two different areas of the brain. And many people think that that's going to hold a lot of clues in terms of understanding exactly what is changing in the brain when people get better.
Getting better, if you can track the changes in the brain, can you cause those changes to be made in order to help people get better?
Well, I think indeed you can. So some of the newest experimental treatments we have for depression actually try to intervene directly in the brain circuits. So if you like, it's like a shortcut into the brain circuit in a way that maybe the psychological therapy might eventually have the knock-on effect of changing activity in that circuit. Same with the pharmacological or chemical therapy. But we do now have interventions that can either invasively, that is from inside the skull, or even non-invasively, that's from outside the skull, using electrical stimulation, change the activity directly in people's brain circuits. So a good example of this is a treatment that's not currently available in the UK, but we hope it will be in the next couple of years, called transcranial magnetic stimulation, or TMS. And this is basically just delivering a bit of magnetic activity outside the skull to a particular part of the brain, which is believed to be dysfunctional in depression, in a part called the prefrontal cortex. And in some patients who haven't responded well to other types of treatment, like pharmacological treatment with drugs, some of those patients seem to get better when we intervene directly in the brain circuit.
And does the effect last?
So that's a very interesting question. So one of the really interesting things about improving people's mood as they're going through therapy is it takes a long time. So the first thing I would say is, how quickly does it happen? When people go through psychological therapy, when people go through drug therapy, the drugs don't work immediately. The therapy doesn't work immediately. It typically takes several months for people to get better. It's almost like the brain has to reset, and we think it has to reset the negative emotional biases that it has become accustomed to, if you like. And that's the same even when you're doing something like a direct brain stimulation intervention, like TMS or deep brain stimulation. Even when you're intervening directly in what we believe is the critical emotional processing circuit, it still takes people 2 or 3 months to get better. And so the current thinking is that you not only have to try to get people better by whatever route is most suitable for them, but also that you have to try and keep them well. So in many cases, people try to combine therapy. So we do have to think about combination treatments as well.
And is there any way you can predict which treatments are going to be effective in which people?
Well, here you're asking the $64,000 question, so I wish I could tell you the answer to that. One way of thinking about this is that we may have different subtypes of depression, or the way that I like to think about it is that the definition of depression, which is just purely based on the symptoms, as opposed to the underlying brain causes, if you like, might not be the same in every single individual who suffers from depression. So you might have patient A who has got a particular set of circuits that are maybe working slightly wrong in a particular way, and then in another patient who's got very similar looking symptoms, they might have a different set of circuits that are operating in a slightly incorrect manner. In the same way as you might have a cough, and that could be caused by a viral infection or a bacterial infection or asthma or lung cancer. Multiple causes can result in the same symptom, and probably that's true in the brain as well. Multiple causes can result in the same kinds of symptoms. So one hope for neuroscience research for the future, and we're not there yet, is that we might be able to find these subclasses of individuals and predict whether this particular treatment, say like a drug treatment, might be very well suited to one subgroup of individuals, whereas psychological treatment might be better suited to another group of individuals. But on the basis of the information that we have at the moment, that's very, very difficult to do. And many patients go through a sort of trial and error procedure where they try many different types of treatment, and eventually they hit on the one that's good for them, but it takes too long to get there. And that's a serious social problem, a very serious economic problem that we need to fix as well.